Nisa Mbulvinaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Navilati. A massive inakavakalegu to all of those that have been following our social media sites, and especially right here on our YouTube channel. Thank you for the subscriptions, the likes, and the follows. Thank you very much. Today with us in studio, we have a very special guest, our very own specialist here at Oceania Hospitals, Dr. Malani. Mbulvinaka, welcome to the show. How are you?
Mbulvinaka, and lovely to be here.
Thank you. Just to kick things off, Dr. Malani, you've had an incredible journey in both medicine and public service. For those who may not know you, could you briefly share your background and what inspired your path into healthcare?
Thank you. Now that's a big question because I've gone on in age, and you did ask me a question earlier on, asking in the last 40 years what has been my most rewarding part of my journey. At the moment, I am at the Oceania Hospital, a general physician, but nephrology, looking after our dialysis and kidney diseases for the hospital. Now that's quite a huge load itself. And prior to that, I've been at the medical school and helping with training the medical school postgraduate students, and that's been for the past 24 years here. But basically my life in medicine has been a journey full of challenges, rewards, and fulfillment, really. And I have had the privileges of helping thousands of patients navigate their health challenges, addressing, diagnostic, management, treatment at various levels of their health delivery. And I have participated in both training of undergraduate doctors and in the process, had the opportunity to develop different programs, especially pertaining to kidney, gastrology, and chest medicine. Now, I grew up in a family of doctors. My father was a doctor and my sister a doctor, and we both trained in Otago Medical School. And as such, I used to help my father, even before I became a medical student or when a doctor in healthcare. My father attended to patients, and that's where it all developed from. And when I went to Otago Medical School, my father told me, "You must come back home and serve." And those were in the old days, and that word rang true to me, because almost 99% of the people that we went together never came back to Fiji. But when I came back, it was 1987, and you remember that year is a famous year in Fiji when the coup happened. So I said to myself, damn, I should have signed that contract, because I was asked to sign a paper to remain in New Zealand as a resident, because the manager of our rugby team, and I was playing for Wellington as a medical student at that time, got me 3 times to sign the paper and said, look, sign here will get you to become the resident. So when I came here and the coup happened, I said, damn, I should have signed that paper. So from then I worked here for a while, and then I took up a position as a clinical professor at the University of Hawaii to train doctors in the Northern Pacific area, so Micronesia. I ended up, we trained 70 doctors in that region through the Pacific Basin Medical Officers Training Program. I also became the clinical director of the training program, and being the director, I tried to set the bar at a very high level. And that was quite amazing, because at that time all the US doctors were being withdrawn. It was leaving a big lull in the whole of Micronesia. So training of those 70 doctors was quite a huge contribution that we had in the training of those doctors who not only finished their undergraduate, but most of them have been to Fiji and did the postgraduate program and went back to be a specialist. I returned to Fiji back in 2000 in helping establishing the postgraduate program. And I was for medicine, Dr. Wamen Bariwilala was for OBGYN and was also the dean. Dr. Eddie McCaig for surgery, Sari Mambale for anesthesia, Elizabeth Rogers for pediatrics. And this was an associated OSAID program that they established the program, and we had counterparts from Australia and New Zealand to help us to start the postgraduate program. Before that, our specialists were sent across to New Zealand, Australia to train. They never came back. And so we had a big task ahead of us. So I don't know exactly now what the numbers that we have, but a few years ago we've had over 14 each specialty master candidates that have graduated, and now they fill important specialist positions and high position in Fiji and in other parts of the Pacific Islands. So now with training comes imparting knowledge, skills, and mentorship. And I think I look at it as a part of a very important part of the role modeling for young doctors and building specialists for the region. So we were getting into a different level of training. Manpower is training specialists for Fiji and the Pacific countries.
Thank you.
Tune in next week for part 2 as we continue our discussion with Dr. Malani and his area of expertise in gastroenterology, nephrology, and chest medicine. Don't miss it.